And we're back. As promised, Dr. Walden from PaducahDentalCare is here with me, and we're going to be talking about your pearly whites. So you ready?
Yes, ma'am.
Okay, so we had lots of calls about implants and dentures before. So what does that process look like calling your office? Like, can we just make a consult?
Yeah, well, right now, for a limited time, we're having free dentures and dental implant consults, and that allows you to come in. The doctor will take a look at you. If any needed x-rays or scans, they'll do that all at no charge, and try to come up with a game plan for your denture or for your implant. And so for a limited time, this is all no charge.
Oh, that's great. Yeah, because a lot of us, if we have questions, then that gets us in there.
Yeah.
Okay, so what is the timeline for a dental implant if we had one of those?
That's a good question, and we tell our patients that you have to be patient with implants. Because it all depends in different situations. If you're putting an implant in to replace one missing tooth, you're looking at about 3 months after the implant goes in before you can put a tooth on it. If you're taking teeth out and want to get implants in, then you're looking at 3 to 6 months, because you may have to do some grafting. You have to let the bone fill in. Now, if you have dentures and your gums are okay and you got bone, then you can put what we call the narrow or mini implants in, and they go right into the bone, and you can use those immediately that day. So you have to have your dentist check it out, see what your bone's like, what your situation is. But we tell patients you have to be patient.
So that's why we need that consult. Everybody's different.
That's correct.
Okay.
That's right.
All right, well, our next caller wants to know, will gum disease impact me getting dentures?
Well, gum disease is infection in the gums. So if you have your teeth and you've got gum disease, the bone goes away, the teeth get loose, and you've got to get rid of that infection. Now, the good thing is, if you're going to get dentures, then you take the teeth out. If you take the teeth out, usually your gum disease will go away. You have to let them heal up a little bit, but yes, you definitely want to get infection out before you have, dentures put in.
Absolutely. Okay. All right, our next caller says, my front teeth are discolored. What are my options to fix this problem?
Okay, well, first you have to, to try to determine why are they discolored. Is it just from, coffee stains, wine, different foods, or is it something intrinsic, like from taking tetracycline when you're a young child? So you need to have your dentist take a look. Sometimes you can just whiten the teeth with the different whitening products, and that will help out and lighten the teeth up. Sometimes you can do what we call some bonding, where you take tooth-colored filling materials and bond it to the tooth to try to hide the discoloration. And if you go to the next step, is when you do actually porcelain veneers, and if you put a porcelain face on the tooth, and you can make that any color you like, and those last long. So you just need to check with your dentist and see what kind of staining you have, and they can come up with the appropriate solution.
Okay, and our last question quickly, you just touched on this. How long does a veneer actually last?
Yeah, porcelain veneers are, they're designed to last a long time, which could be 10 to 20 years. It all depends with the patient, the oral hygiene, if you take medications, if you've got gum disease, so it just, you have to, everybody's different, but you would put them in, you want them to last a long time.
Absolutely. Yeah. Well, thank you so much for clearing up some of those questions for us. If you would like to revisit this segment of Family Health Experts, log on to WPSD local6.com/Family Health Experts. Up next, Stephen Beasley and Nikki Chappell from the Regenerative Center will be here with me, and we're going to talk about preventative health. That's up next on WPSD Local 6 Midday.